Good morning. Today's date is February 20th, 2020, and you're listening to episode 10 of Coronavirus Central, your daily source for information about the COVID-19 pandemic. I am your host, Tom Kaczynski, and today we'll be offering tracking on the number of cases, updates on the outbreaks that now appear to be happening worldwide, major news developments in the United States, a review of some economic information, a couple key updates to how this disease potentially updates, and we'll try to figure out some ways to stay safe through all of this. As always, this podcast represents the combined efforts of a public information network that is open source and that we invite you to join. We now have over 400 members at t.me/coronavirus central who are sharing information from around the world. All podcasts for this program are hosted at www.coronaviruscentral.net, and information and questions can be sent to the podcast at coronaviruscentral@pm.me. I want to make a special point to thank those who are sharing information with us and updates from the ground as well as your questions. We try to answer those, and I want to thank the many people who turned up for the YouTube channel to listen to our question and answer and review session, which will now be held on Monday, Wednesday, and Friday evenings at 7 p.m., and there is a link available to the YouTube channel on the Coronavirus Central website, as well as under every episode. So you can get access to that. As always, we are an independent organization seeking the truth, reporting the news as we find it, offering our best assessments, trying to strike the balance between what we can prove, what we think may be true, and things we're watching that we want to see if they become true. There's a lot of misinformation out there. We don't always get it right, but we work hard to tell you what we're trying to figure out. So we're going to work together to try to protect ourselves, our families, our loved ones, and our communities through this pandemic. And thank you, as always, for listening. So today is going to be an incredibly packed episode full of informational content, and we're going to go to a number of different places. I had hoped to do a deeper show on some of the impacts in China, but that is proving difficult because the amount of censorship happening from there is expanding rapidly, and the people who we do have contact with are having a harder time getting information out as the Communist Party there is working to suppress the flow of information with the Great Firewall going up much more broadly. As it is, it's something we will continue to work on, but there's been a number of breaking news stories today to look at, and just as a quick preview for what we're going to talk about today, we're going to talk about the rapidly expanding outbreak in South Korea, the continuing expansion in Japan, what China is doing to suppress their own people, and a deeper look at what is happening in the United States right now, as well as some scientific information that is still preliminary, but that is potentially very distressing. So we're going to hit a lot of places, maybe less deeply than we've been doing in previous episodes, but to give you a feel for what's happening. Links will be provided for the relevant articles, and I'm going to direct you as well for some different places you can look at to get additional research. Things are starting to pick up, and it's really important we talk about that as we go forward. So let's just jump right into the numbers, a little explanation, and then to the stories. So COVID19info.live is our daily source that we're using for these big numbers here. And as of 7:40 a.m. on the East Coast, the confirmed number of cases is 75,788. The death total is 2,130. The recovery total is 16,850. And as I've said, please keep in mind that people can have this more than once as best we can tell. And we have seen a startling drop in the numbers being reported out of China, where the numbers reported as of the 18th were 74,279. Now we saw that number only jumped an additional 380, I think it is, just about, to 74,675 in Hubei, and then another 19 spattered around. So under 400 cases are reporting, which would be absolutely great news if we believe it. We'll talk about that in a second. What I want to include here is we're going to use bnonews.com. That's on their index. They have a tracker for the numbers of cases reporting worldwide here, because they have sources for each and every one of these cases, and there's links available on the site. And there have been some huge jumps out of East Asia specifically, that we now have 104 cases in South Korea. It's nearly tripled overnight. We're going to talk about that. Japan is up to 92, Singapore 85, Hong Kong 65, and then we scatter down. Thailand's at 35, Taiwan 24, Malaysia 22, and the West continues to report numbers in the mid-teens, with the United States actually reporting 15 from the CDC, which is really interesting, because until they independently verify their own tests that the people who were verified in Japan as having coronavirus, who were on board the Diamond Princess, they're not including them. If they did, that number would jump to 30, and they're not doing that. So just one more example of how statistical reckoning is suppressing the number of cases that we know, assuming we believe the Japanese numbers of the case tests, which I think we should at least assume is likely, is accurate. So what we see is a real breakout happening in Asia, and we need to talk about this for a second. So that you understand what these numbers really mean and how they're jumping so fast. We've spent a lot of time in this podcast talking about the transmission value, the R naught, and the exponential function by which the number of cases jump. And the number that has been most commonly used in the media is that the cases are doubling approximately every 6 days. That number may be optimistic or pessimistic. I personally believe it's a little more effective than that. In a unhindered environment, there are certain quarantine protocols that offset that, and it's important to recognize the R naught transmission factor is highly dependent upon how much contact people who are sick are having with people who are not, and the precautions that society takes to prevent that are relevant. However, just thinking of the math real obviously, if you have one single case, a patient zero as it's called, and you're thinking how long will it take to get to a certain number of cases, let's assume, just to make this math easy, that every week the cases double. So in order to get to 50 cases from one case, you're thinking week 1, 1 case, week 2, 2 cases, week 3, 4 cases, week 4, 8 cases, week 5, 16 cases, week 6, 32 cases. And it's only in week 7 when you hit 64 cases that you've made it there. So you're talking about maybe 2 months even, depending on how fast this is going out there. In our current case, we're looking at something closer to 40 days. But if you think of how that math goes, again, from 64 to 128 cases is just another week. Or as we're observing here, it can happen in 6 days. Or as we're observing in South Korea, we've now seen the cases triple in a matter of just 1 day. And that doesn't mean that the number of cases was magically appearing that quickly. What it means is we're seeing the exponential function start to take off. And remember, as we've talked about over and over again, and the New York Times reported 2 days ago, that we are looking at a case where 80% of the cases are, either asymptomatic or mild, which means for the cases that are being reported, which represent 20% of the cases between severe or critical cases, we can make a reasonable expectation that some percentage of those other 80% of cases are not getting captured. And given the number of people who are getting checked and the availability of kits, I think it's reasonable to conclude a majority of those cases are not being checked, which is how you can see something like what we're seeing in South Korea today, where the caseload jumps by, what we talk about, 70 cases. Yet, at the same time, Interestingly, we see China reporting that now they only have 380 new cases. And so we're going to talk about China first, since it's still the biggest number, and since I think there is a growing body of evidence that China is not telling us the truth. They have refused to allow CDC officials in from the United States and other countries. They have limited the exposure of World Health Organization officials to places like Beijing, where they're basically getting anesthetized presentations. And an article that came out yesterday in the Daily Star, I think, deserves a lot more review. And the article goes, China deploys 40 incinerators to Wuhan amid fears of coronavirus death toll cover-up. And Chinese media reports that the mobile furnaces used for burning animal carcasses and medical waste have been shipped to the center of the COVID-19 outbreak. So they sent 40 industrial incinerators that I've read can supposedly, rather than the funeral homes, which take 50 minutes from what's been reported from NTD News to take care of bodies, these can sometimes take care of organic waste, let's say, in a matter of minutes from what has been reported. They can destroy, this is from the article from the Daily Star, the mobile incinerators can reportedly destroy up to 5 tons of waste every single day and can burn its load in as little as 2 seconds. So you have to ask yourself, why does China, which has been to this point slaughtering their animal supply by the millions by basically dumping them into pits and throwing dirt over them. There's a lot of video about that you could find very easily. Now they are bringing in these incinerators to kill off the animals who are already dead. It doesn't seem to fit. The suggestion is that they are probably using this to remove human waste. And I had a friend in China who was telling me 2 days ago the 3 things they're requesting most there are body bags, or excuse me, not, it's the right word, masks for personal protection, eye goggles, and body bags. And that we have multiple sources who have told us that there have been big orders of body bags being shipped over there. There are videos that were escaping even as early as 3 weeks ago of multiple bodies being thrown in the back of vans. So the death toll in China looks like it might be a lot higher. More on that in a minute. But these incinerators we're talking about, reportedly the cabin of these is the size of a 20-foot solid or standard container and has the volume of about 30 cubic meters. So if you think of what those huge trash dumpsters look like, basically, the ones you'd see at a dump, this is literally the size of things that are being brought into China. By 40 of these were being brought in. And they are saying that the virus cannot survive this. And one of the professors in this article, Professor Ming Zhu, reportedly said he believes the cabins are mobile incinerators for bodies. So we're going to go through this a little bit more in detail. The article talks about the number of people who have died and that the toll had been going up until this had happened. Now, this article is 2 days old here. But here's what the Chinese government is saying. The numbers of new coronavirus cases are continuing to fall as China claims it is getting to grips with the outbreak following the intervention of Xi Jinping. Officials have been carrying out a door-to-door campaign in Wuhan to root out anyone in the city with the infection. This must be taken seriously, said Wang Zhongling, Wuhan's new Communist Party secretary. There's nothing more important than human life. These are quotes from him. If a single new case is found after Wednesday, the district leaders will be held responsible. However, experts have warned that the threat remains as Chinese nationals continue to return to work following the Lunar New Year. And so let's go back to what he said, to what this the new secretary of the Communist Party in Wuhan, Wang Zhongling, said. If a single new case is found after Wednesday, the district leaders will be held responsible. So here's what we know on the ground. Cases are exploding everywhere else around the world. China claims they have this under control. They sent 40 incinerators in, and they have told their own government that if cases continue to be found, that the leadership of the party will be found responsible. We would like to believe that this means that the worst is over for the poor, ravaged people of Wuhan. However, the preponderance of evidence suggests that what we are seeing now, and is very likely, given the videos that we've seen of people being barricaded in their homes, people resisting like their lives depend upon it, being taken to the quarantine camps, and the growing information blackout, is that we are now facing the potential of a pandemic-driven state-assisted genocide in China. And I know those are very strong words, but we also know that the idea that this caseload is going down runs against every bit of evidence that we have. And we desperately need to see people get in there and information get out of Wuhan and Hubei province, as well as the other places which are under quarantine. We know that the Chinese people are being sent back to work, and the fear that they have that has been expressed to this broadcast is that they are being sent there with the government realizing this will exacerbate the outbreak and wanting to go ahead and restart the economy at all cost, accepting as high as the 20% death rate or higher, which has happened from the initial series of infections in the Hubei province. Given that the Chinese economy is desperately is struggling, as we reported, the productive capacity has been reduced to about 10%, economic activity to under 20% in a number of areas and provinces, including cities like Beijing and Shanghai. And we see in Hong Kong the same thing is happening, even though it's an autonomous province. There is a major concern now that this is happening, and as we see this outbreak happening around the world, which is going to draw the attention of people around the world to their domestic situations and to the threats to their own and their families, which we will cover, we cannot forget and must not forget the people of China who are potentially behind this firewall suffering a terrible human tragedy. And we need to have people on the ground there. I don't know what's happening there. I can only report based on the trends and the evidence that's out there, but it's very concerning. And the reason I'm so worried about this is because we see those outbreaks elsewhere. So there was an episode yesterday. Steve Bannon runs a show called War Room Pandemic. It's very good. I recommend listening because it does a very deep geopolitical analysis of this. And one of their people that's on there, his name is Dr. Steve Hadfield. He worked for the U.S. Army, had a career there basically studying virology. He got sent to hot zones, places like Ebola, the SARS outbreak, wherever the U.S. military could go. This was the guy who went. He was saying on his part of the show that this outbreak has broken out beyond the ability for social quarantine, which is to say that it is impossible at this point, in his professional opinion, to quarantine this disease out, or the only thing we can do is we can quarantine ourselves in to protect ourselves from it. Too many people have it in too many ways that they aren't aware of because of asymptomatic transition for us to figure out what's happening. And interestingly, it's worth listening, although this particular episode was garbled because of some audio transmission properties. That they were talking about that they think that this organically developed, but it may have been out as early as October or November, and that there's a little bit of evidence to potentially substantiate that theory. We'll talk about it, and we will present counter evidence for the alternative theory that this is bioengineered. We don't know the answer. We're concerned with solving what this is, and we'll have time later to figure out all the how. But on this episode, Miles Guo was on there as well, and Miles Guo is a powerful dissident who's very well funded, but he continued to repeat his claim that he believes, and his sources are telling him, that 5 million people in China have been up to 5 million people in China have been infected with this, and that the death toll is well into the hundreds of thousands. That would better fit the statistical evidence we have seen based on the early research from Wuhan, as well as the exponential progression rates we are now observing in South Korea, Japan, and other countries. The Chinese Communist Party does not want to admit that, and the Western markets don't seem inclined to push them on it. But one other interesting point from this episode, and I will share a link to it so you can check it out yourself, is that Steve Bannon was claiming from multiple sources in Hong Kong that the number of the outbreak there is at least 10 and probably closer to 20 times what has been publicly reported. And just to put that out there, BNO News is saying as of today, based on World Health numbers and their own health ministry, that number is at 65. You are literally seeing a run on the markets, or not run on the markets, the run on the stores there to get supplies as people in Hong Kong like many other people, are not necessarily believing the health numbers are accurate with respect to what is happening on the ground. And he did a lot more research about that. China brought in their vice premier and the woman who was the head of basically their biological weapons program from Beijing has now taken charge in Wuhan. So whatever the case, China has brought in their heavyweights to deal with this. These are people who have seats on the central committee there. And as I'm coming to understand the internal politics, these are basically the people who are brought in to get results and to make problems go away at any cost. And, we know, even going back to the sad case of Tiananmen Square, what China's Communist Party has a history of doing. So we'll leave China for a moment, and we're going to go now from there to an odd piece of data, which I shared on the Twitter. I just wanted to share this because I don't know what to make of it. I think it's potentially important, but it fits with what Dr. Steve Hatfield was saying. And this is from Jennifer Zhang at NTD News. Her Twitter is at Jennifer at NTD. And if you want to see a lot of videos and stories, I think we follow her on our account. We do. So you can see that at Coronavirus Cast on Twitter. And she has a lot of details. But there's a document that's coming out. And this is from September 18th, 2019. I have a copy of it in English translation as well as in Chinese. And Tianhe Airport in Wuhan did an emergency response drill, presuming a passenger had a coronavirus infection. Out of 10,000 different diseases, why did they choose coronavirus? We saw the same thing with the Event 201 action. And we saw this, and admittedly, SARS was a huge coronavirus that hurt China, but more recently, they had outbreaks of the swine flu, of the bird flu, and we're talking about something in this case that was 17 years old. So it's in one more data point in the strange confluence of why everyone was talking about coronavirus before this happened. Did governments know that there was an outbreak? Were they working on chemical weapons, biological weapons? We don't know, but there's a whole bunch of evidence that people are going back and seeking about coronaviruses as being of specific interest. Could be coincidence, could mean something. You decide. Okay, so we're going to go to the Middle East for a second here before we go back to East Asia. And Iran had reported 2 suspected fatal hospitals at Qom Hospital, and this came out of left field. We haven't heard much from the Middle East other than that United Arab Emirates had a couple cases, and Egypt reported their first case. But we have 2 deaths now, presumably of Iranian nationals, that are coming out of the Middle East. And BBC reported that there were 2 deaths. I've seen other studies say perhaps there could be as many as 4. We don't have that confirmed. And what we do have that is presumably more confirmed from the state, I'm going to share this thing. It's from the Islamic Republic News Agency, is 2 patients suspected of coronavirus quarantined in northern Iran. This is in addition to the 2 that have been reported, and they confirm here the families of the 2 dead patients and 2 other suspects are not quarantined, but health advice has been offered to them. There have been videos showing that there has actually been a military deployment in Iran to Qom. We don't know if it's related to the coronavirus or not, but it's definitely concerning because this represents the first evidence we have of a widespread transmission beyond the East Asian corridor. And the reason why I say it's particularly concerning isn't that we just saw 2 or 4 cases in Iran. We saw 2 people die in Iran, and presuming that they have followed the standard course of this infection, which we understand takes somewhere between 7 to 10 days to reach the pneumonia stage after a period of anywhere from 1 to 24 days of asymptomatic transmission. When you get to the point that people are dying from coronavirus, that means it's probably been in your country for 2 weeks to probably at least 4 weeks or maybe even 6 weeks. We don't know the exact numbers, but what we do know is that when you see this happening, it's like if there's carbon monoxide poisoning. When you see the dead body, it's already too late. Iran may have a lot more cases, and this offers perhaps a frightening but realistic viewpoint into countries that have not been using heavy surveillance mechanisms or restrictions, and I'm thinking of India, I'm thinking of Pakistan, that may have a lot more cases than we know that are getting misdiagnosed as the flu, any number of things. So definitely very concerning what we're seeing here. Okay, so now we'll continue our tour, and we are going to South Korea. The Associated Press reported at 1 a.m. Last night, or I should say this morning, and that's Eastern time, the South Korean city of Daegu urges its 2.5 million people to refrain from going outside as its virus cases spike. And we will talk about this in a little more detail. This article is from the Washington Post. This has live updates as the coronavirus cases surge in South Korea. As first reported, mayor tells residents to stay indoors. This is by Jerry Shi and Teo Armis, updated at 7 a.m. Eastern, which is just an hour ago. And what it's saying is... Let's skip here. In South Korea, cases soared by nearly 2/3, mostly in the southern part of the peninsula, national authorities said. The mayor of Daegu, the city where 10 South Koreans contracted the disease from a church service, asked residents to stay indoors. Iran reported 2 infected people who then died. And the first coronavirus death was reported in South Korea. The mayor of the South Korean city urged its 2.5 million people on Thursday to stay indoors. As cases of the new virus soared, cases in the country rose by 2/3 to 104. And there was a good article on that peak prosperity video we're going to talk about later that went into the details that they believe they have a super spreader who was responsible for reaching at least 15 people they know about. And they did a study, the South Korean Health Ministry, or at least they released statistics, of people who they thought this woman was in close contact with. She got 10% of them sick. And if that's the sort of transmission rate that's happening, because we don't know she's a super spreader, it's being assumed she is, but we really don't know how many people are being reached by any given person. If that's the case, we're going to see a much broader spread of this. We also saw 2 passengers, this is from the same Washington Post article, 2 passengers from the Diamond Princess cruise ship died Thursday, the first fatalities from the virus-stricken liner. A day earlier, an infectious disease specialist slammed officials for failing to observe proper quarantine practices on the vessel. It was really bad. I mean, if you read that article that's linked in here, they were taking gloves that were supposed to be protection, and they were eating food with them. And they had the sick passengers in the same wing as the healthy passengers, presumably because they didn't want to remove them. And even worse, after a 14-day quarantine for a 24-day disease, Japan released 500 people into their own country without any further protection, just saying, well, self-quarantine as best you can, but you're probably okay. Not surprisingly, we see the outbreak in Japan rising. We're now up over 90 cases there. That number is going to continue to rise. And there's a really good article on that piece. We'll just jump for a second from the Straits Times out of Singapore saying, as cases mount, Japan is rapidly becoming a coronavirus hotbed. So, adding to the worries is that passengers who began leaving the quarantine vessel on Wednesday, February 19th, amid concerns some might later test positive and take the virus to more parts of Japan. The situation is growing more alarming as Japan's elderly population and work ethic present high-risk scenarios for the outbreak's spread. The Japanese government's decision to wait for the China-friendly WHO to make its much-delayed declaration of a global health emergency led to the first cases of domestic person-to-person transmission and tarnished the country's international reputation. So what we've seen is Japan has basically failed in their quarantine and containment procedures, something that is really terrible with respect to the ship because it was understood this was a very big danger threat, and now the Japanese people are going to be put at peril. There was an interesting article. I didn't post it, but it was talking about the big PAX East conference in Boston, and Sony's not sending their people because Sony is at home starting to act to put their people into work to home from quarantine. We saw that listed in the review of Japan. The number of companies that are making those options are growing, and yet the government has been lagging terribly behind in Japan. South Korea apparently is being more aggressive about this, but as we've seen, their caseload jumped by 2/3 in one day. And now we are seeing one of their larger cities, 2.5 million people, Daegu, that's going out there and saying we do not want people to go out. And we don't know how many people are going to have this, but what we see is we are at the beginning of that spike you might expect of exponential progression. Remember, doubling every 6 days is the projection the media is giving us. So let's just use that. If now we have 100 cases, 6 days from now, 200. 6 days after that, we're looking at 400. 800, 1,600, 3,200, and you just can't contain at that point. And odds are the more people who get this, the more people who will be able to get it in the absence of effective quarantine procedures. Then we're talking about that economic shutdown we've been discussing happening in South Korea and Japan for up to 30 days if done properly. The alternative is the Chinese model where they've done the 14 days. They're basically removing the sick and telling people get back to work. We care more about the economy. I don't think that will fly in the West or in most East Asian countries. So what we are seeing are these voluntary self-quarantines that are being highly recommended, but that ultimately are not being followed because people look at this in a country that has millions of people and say, if there's 100 people with cases, how much do I need to worry? Well, you don't have to worry that much until you realize that what you're really dealing with is that 2, 4, 8, 16, 32, those 100 cases are going to become 3,000 in a month's time or more. And I actually think that number will accelerate more quickly. Remember what we saw in Wuhan as a test case before they started doctoring the statistics. We saw a small number of cases go ahead and get into the tens of thousands in a time just a little over a month. We will see the same thing happen in other places. And the truth is, it's probably already happening, given the mathematical modeling that seems most sound that countries are not reporting. So we know South Korea is in trouble now. Japan is in trouble. Taiwan's numbers are up. Singapore is being stable today. They may go up. Day to day, don't judge by one day going well and one day going poorly. There's going to be peaks and valleys as clusters emerge that affect different people. We talked about a cluster in Tokyo yesterday. We see a cluster in Daegu today. Wuhan was the original cluster. There may be another one in another place. We don't know. And we see as they trace these, it goes to a single church or to a business meeting, and that this can spread all over the world. And if we go back a little further, for instance, the first cases in the West came out of a Singapore business meeting where there were a number of Westerners who then went to France and went to Britain, and there was one super spreader who basically brought this into, I think it was Switzerland, France, and England. And he didn't know. I'm not blaming him. It's asymptomatic transmission. But that we see this happening over and over again. And, we have other things happening worldwide. Brazil is about to have Carnival, where there will be millions of people descending upon there, all in close contact, doing things that are likely to lead to fluid transfer, right? So if one or two people go there who are sick, they don't know. Maybe they're from Thailand, Malaysia. Maybe they're from the West. We don't know. There's this potential for a huge outbreak, and people are just not taking this seriously enough. They need to begin taking protection protocols now, because by this time next week, it will be obvious this global pandemic is now threatening thousands of people and potentially even tens of thousands of people outside China. I know that's a big prediction, but there's a story in virology that applies here. Nobody knows until everybody knows, and when everybody knows, that's when the panic sets in. So we're going to talk here for a moment about the United States, because there really hasn't been a lot of coverage, and people have been saying, well, the United States only has 15 cases, or if you include the new quarantines being brought back to Nebraska, and I think there were 2 cases in California related to that that have not been externally confirmed. Let's say we have 30 cases. I think that's more accurate as of the reporting who have been internationally confirmed, not by the CDC. What has been happening in the United States? There have been, I know, at least a dozen stories of people who went in, who had symptoms, that they thought could have potentially been coronavirus, and they were told it's the flu. And you see the mass media reporting that we are having a terrible flu season, which very well may be true, and I have no reason to doubt that's true. However, we also have evidence that the symptoms of coronavirus look a lot like the flu, and that we do not have testing that's happening. We have people who think they have the flu, who may or may not have the flu, or may not have coronavirus, going to hospitals, going to intensive care units, going and seeking treatment where they are requesting tests and they're being told, well, you don't have that, go home. Or when the only people who have been tested, to my knowledge, that are being publicly admitted to are people who have traveled to either Wuhan or to China or been in close contact with people from there. And as we are seeing that if you were in contact with people from Japan, from South Korea, from Singapore, from Hong Kong, you could have just as easily got this. Furthermore, as we have seen in the Japanese cases being reported, Uber, taxi drivers have become vectors of where these diseases are coming from. So let's say you get in a cab out of an airport or, just from the airport itself, and you're in contact with someone who went to Wuhan, you have no idea this is spreading. And they're not reporting it. They're simply not reporting it. But what they're saying, and this is what's starting to come out, is a series of stories, and I'm not going to read the details for every one of these, but I'm just going to go and read the headlines of this. The Atlanta Journal-Constitution reporting from, I think it was yesterday, or no, this is from February 11th, I apologize. Close to 200 Georgia residents are being monitored for coronavirus on self-quarantine. Wall Street Journal yesterday. Amid coronavirus, U.S. cities stretch to monitor self-quarantined Americans. Key quote, more than 5,400 people had been asked to self-quarantine in California alone as of February 14th, according to the California Department of Public Health. Hundreds more are self-quarantining in Georgia, Washington State, Illinois, New York, and other states. Remember, we had reported the CDC is now sending test kits to Chicago, New York, Seattle, Los Angeles, and San Francisco, all right? Another one coming out. This is a little bit more detailed. This is from Tuesday, February 18th, KOMO News in Washington. Officials, 746 people in Washington being supervised due to coronavirus outbreak. And as this is a more local news source, I'm going to read this article to you because what we are doing is we're delving deeper into why the numbers in the U.S. don't match what we expect. More than 700 people in Washington state are being publicly supervised for coronavirus, according to new results from the Washington State Department of Health. And I give credit to the Washington State Department of Health for admitting something. The main website where I live hasn't updated their blog since 2017. Convenient, right? The department said Tuesday 746 people in the state are under public health supervision, including those at risk of having been exposed to the novel coronavirus. These people are monitoring their health under the supervision of public health officials. So what does that actually mean? That they're just saying sit at home and get back to us if it gets worse? The figure includes close contacts of laboratory-confirmed cases, of which they claim there's one, as well as people who have returned from China in the past 14 days that are included in federal quarantine guidance. As of now, the department said 26 people in Washington state have been tested for the new virus, with only one confirmed case in Snohomish County. I believe that's near Seattle, if I'm not mistaken. One result is still pending, according to the department. Quick interjection here. One of the things we found from Japan was that there were a lot of false negatives in this testing. Some test kits, and the CDC even themselves admitted this, and we saw this in an article in the New York Times we reported on last week, up to 50% of the test kits are wrong. So we have people who are self-quarantining who are theoretically getting tested, and this is the thing that really got me upset, that they are saying in this article, well, let's finish the article first. There are 15 confirmed cases of coronavirus in the United States. The virus has killed 2,004 people in mainland China. So they say in this article that there are 26 people who have been tested, over 746 who have been self-quarantined. So the CDC and the Department of Public Health in the state of Washington have tested 3.5% of those people they suspect who could have coronavirus. And these are the most high-risk people. Why aren't they testing more of these people? Why aren't we getting more information? Could it be because the CDC does not want there to be a public panic? And let me add another piece of evidence to this, that where you see test kits in other places that are being analyzed directly on site or mobile to the place where the outbreak is happening, in the United States, the existing protocol, as I understand it, that I've read as being reported from the federal CDC themselves, is that these test kits for people who have been in China or in Wuhan, who have been there in the last 14 days, are supposed to send the test kits to Atlanta, where then those results are reported back. So we see the government collecting all the information at one site rather than allowing that site to be spread elsewhere. The information to be collected locally, which would A, be faster, and B, represent multiple sources of information. Now, for those who study governments, and we see this in the Chinese response in Wuhan, what you uncover often is that when they do not want information to get out, all information is gathered in a single point. Think of different scandals of budgets, of money being lost for accounting. A number of examples. The Pentagon just lost a few $1 trillion, perfect example. Same sort of way, CDC is collecting all this information. And what percentage of cases are they checking on? We know from 3 states alone that over 6,000 people have been checked. If we were to extrapolate that outward, and there are states that don't have as many, but it's everywhere. This is from the Grand Forks Herald, written by Hannah Shirley. 10 in North Dakota monitored for coronavirus. There are no confirmed cases of the disease in the state. All those being monitored traveled to China within the past 2 weeks, but not in Hubei province, where the virus is most active. So we have a 14-day quarantine, right, that we're dealing with for a situation where we know we have a virus that has up to a 24-day period, all right, that can incubate, where these people are primarily being made self-quarantine. And if we just do a quick math, and this isn't quite fair because California probably has more cases, but if there are 6,000 cases in 3 states, okay, and let's say that represents what would be the average, just say 10 states, because California is very populous. It represents about 20% of the population, so 10 divided by 50 is 20, right? 20% rather. What we would have a suspicion of is that there are probably somewhere in the neighborhood of people in the United States under self-quarantine that would be 30,000 people. All right, and I don't know these numbers because there's no public reporting. You can find, if you look throughout the internet, you'll find a county has 10 or 15 here. Some things are being organized at the county level. Some things are being organized at the state level. Some things aren't being organized at all. And yet we are supposed to believe that we now have, and I'm using the number 30 instead of the 15 they're publicly reporting to include those who came back from the Diamond Princess, that in a place where 30,000 people are under quarantine, the 30 cases exist, and we are only testing, if we're using Washington as an example, hopefully they're doing better in other places, but if we're testing under 5% of those cases, how can we have any confidence about the number of cases? Is it that the CDC is not taking this seriously? Is it that they lack the capacity and the resources to do this? Or is it they just don't want people to know? I can't answer that question, but I will tell you this. When you see, not if, when you see the cases jump next week, you're going to be asking that question much more frequently. And my suggestion to you is, if they expect us to believe that the case occurrence rate is literally 0.1% for people who have been exposed to coronavirus, when we know that one person in South Korea who was a traveler infected 10% of the people, I don't believe, and there's no evidence to suggest that people in South Korea are 1,000% more infective than people in the United States of America. That does not hold. It does not make sense. And it is a public health failure that starts from the very top and goes down. And this should not be a political issue, but the failure is a universal one across all parties and all levels of government in the United States. And, we see this. The gentleman from Buffalo is being attacked by the media and threatened for reporting that there is potentially this on the ground. And you hear rumors of gag orders. You hear about hospitals that have wards you can't go into. We don't know what's happening, and we're not being told. And what I'm going to expect is that as we see these case outbreaks over this weekend accelerate in Japan, Singapore, Hong Kong, and South Korea, as well as potentially North Korea, and maybe other countries we're not even talking about, India, Pakistan, Bangladesh. We don't know, Malaysia. What's going to become impossible to continue hiding that people are being sick, and people will shift their emphasis away from China, which is signaling to the market, allowing them to make certain actions, and toward the understanding that we really have a worldwide pandemic. And at this point, the numbers reveal it. It's just a question of normalcy bias, people not having experience of this and not understanding that that exponential progression has already begun, and now we are going to accelerate. Remember, in exponential progression, you gain half your caseload in the very last iteration of a series. So every time that you're dealing with something, it's going to get twice as big. So even though it can take a very long time to get to a certain number of cases, be 100, 1,000, whatever it is, the doubling happens the very next time. And it's something that is hard for people to understand, and it's why public health officials as well as politicians simply do not understand virology. And you know, it's a fair caveat to throw out there that it's very hard for people who are habituated to understanding that things happen gradually and sequentially to understand viruses don't happen that way. They are a math equation that is run amok. If you want to think of it that way, think of it as how fast the meter runs up on a taxi. You know, it's much more close to that, where a little bit of delay equals a lot of outcome. And I wanted to add another piece that, I think is relevant for the United States, and this is from informador.mx, and I'm reading this in translation. I will put the original link in Spanish for those who want to read it that way. But 2 suspected cases of the new coronavirus in Jalisco are reported. The SSA, which I guess is their health ministry, reported that it is a child under 4 years of age and a man of 24 who traveled to China and returned on February 6th. We are not even talking about Mexico or enough about Canada, where there have been some confirmed cases, about transfers coming across there. It's well known there are large populations of Asians who would have traveled from Canada to China, especially considering they had their border open in Vancouver and Toronto especially, but also throughout other places, ranging from Montreal, Edmonton, Calgary, especially rural British Columbia, and we see this now in Mexico. So we don't have any border barriers up. We don't have any admissions for what needs to be done for protecting nurses. And something I'm going to bang on every day is that we need to be protecting our healthcare professionals. They need to be in masks. They need to be in goggles. They need to not be the ones that get sick, because we know from China, we've seen in Japan, it is the healthcare professionals that get sick first. And those are the people that we are going to need most to get through this crisis, so that those who are severely ill can be protected. We want our providers to be protected. We want our patients to be protected. But the government's insistence and the CDC's insistence that they not cause a panic is making this outbreak so much worse than it could be otherwise. And if you've ever seen Contagion or any of those movies, you see how this happens. And it's a lack of political accountability. So we're going to go in this last section here, we're going to talk about the science of this. And I am not necessarily the best person to speak to this, I'll own that, but I'm going to share my understanding of this as best I can. We're going to start with the video that Peak Prosperity did yesterday. That's Chris Martinson's site. We're going to link that. And you need to be watching this every day, folks, even if you're just listening in. The video is coronavirus infections outside of China are growing exponentially. But the question he's been dealing with, and he has a background in epidemiology and as a doctor, is he's talking about this question of the second exposure. And we've talked a few times about this question of the cytokine storm, cytokine storm rather. It's that this idea that when you get the second infection, there is something impacted in your immune system such that it can be more harmful. And we've been speculating to this point that the means of entry along this angiotensin converting enzyme is that we see entry happening through the lower lungs, the respiratory system, which fits the exposure we've had where people have had severe viral pneumonia. That does seem to be happening in at least some cases. But what we also find, and I'm not going to go into much detail about this, but I do want it to be shared, is that, and this is from the New England Journal of Medicine, SARS-CoV-2 viral load in upper respiratory specimens of infected patients. And I think this is really interesting. What it basically says here is that there's a lot of scientific details here, but I'll skip towards the conclusion and share this and let you review the data if you want. Our analysis suggests that the viral nucleic acid shedding patterns of patients infected with SARS-CoV-2, which is the formal viral name for COVID-19, resembles that of patients with influenza and appears different from that seen in patients infected with SARS-CoV. The viral load that was detected in the asymptomatic patient was similar to that in the asymptomatic patients, which suggests that the transmission potential of asymptomatic or minimally symptomatic patients. These findings are in concordance with reports that the transmission may occur early in the course of infection and suggest that case detection and isolation may require strategies different from those required for the control of SARS-CoV. How SARS-CoV-2 viral load correlates with culturable virus needs to be determined. Identification of patients with fewer no symptoms and with modest levels of detectable viral DNA in the oral pharynx for at least 5 days suggests that we need better data to determine transmission dynamics and inform our screening practices. And this is a study that came out of the Chinese Center for Disease Control and Prevention, as well as in consultation with Hong Kong. And it looks like it's primarily out of Zhuhai and Guangzhou, the number of reputable scientists and medical researchers involved with this. So translating that to English, what they're saying is that not only does this have potentially the lower respiratory transmission, which we've talked about, it has an upper respiratory transmission where the viral load can look just like the flu. And so you understand the reason you get flu-like symptoms when you get the flu is because of where the attack happens in your body. It's not quite that simple, but essentially where the virus enters is where you have the most suffering. The inflammation that leads to the stuffiness, to the inability to breathe, to the pains in the chest, to the fever for the increased rate of the body creating antibodies to fight off infection. So what this is telling us is that asymptomatic patients are difficult to check. Viral RNA is there, and that this is going to look a lot more like the flu in terms of how it spreads than it would like SARS, or that we're going to look at just this pneumonia dose. We have noted in the United States we are having one of the worst flu seasons on record, and people are starting to do research, and I hope more research is done on this, about this question of, are we having more flus that are unidentified because it's not the flu? The coronavirus is here and we don't even know about it. That is what this original research that is being reported in the New England Journal of Medicine as correspondence here. It's not peer-reviewed yet, but we are early. This is from December 19th, and I will share it. It has a lot of detailed information that people should be worried about, okay? So we're going to go back to the Martinson video, and he was talking about second exposures. And if you go about 17, almost 18 minutes into the video, he starts talking about dengue fever. And dengue fever is a tropical disease where what happens with it, and I'm really oversimplifying this, you should watch his video, take the 6-7 minutes, get informed. Essentially, the first infection is really bad, but the second infection is worse because what ends up happening is antibody-dependent enhancement. The virus links onto the antibodies, uses that to invade the cells, and so the very cells that should be working, those antibodies to protect you from a virus, actually become carriers for the disease. And that's why throughout the tropics, it's understood if you get dengue fever a second time, even though in the first time of proper care, the risk of death is very low, 1 to 2%, that number can jump to 20%, even potentially 50% in certain scenarios, given the severity of the disease, because what happens is that the immune suppression does two things. Number one, you have the disease directly entering where it should be being stopped, and as your immune system is compromised because the antigen, that's to say the viral load that's entering, comes into your body, suppresses your immune system, and is causing you to be vulnerable to secondary infection. That's why when you go to a hospital, a lot of times they'll give you broad-spectrum antibiotics, not because you have a bacterial infection, but because your immune system being suppressed cannot stop it. And so we've seen this with dengue fever, and what we're starting to see potentially, and this is early, but is this antibody-dependent enhancement is actually happening potentially with secondary infections with the COVID-19 infection. And it's too early to tell for certain, but here's how it would work if it happens, is that there's something called a titer, which is basically the amount of antibodies your body is carrying. And when your antibody load is full, like right after you get sick, your body knows you were just sick, and therefore it's fighting things off at the most active level. Over time, your body will reduce the load of antibodies it's carrying, and that titer load will fall. In the case of dengue fever, after a certain set amount of time, and study goes into that, it's different for every specific strain of that, they have 4 of them, that what happens is that you can get reinfected, and the way that the virus attacks is it bonds to those antibodies instead of the antibodies beating it off, and so you end up fighting a terrible disease at the same time that your immune system is suppressed. And because the body, then the antibodies are linking into cells, what we see is that beyond the sort of cytokine storm measures we've been suggesting, where it is the ACE protein itself and the function of it that it's being disrupted that is causing these problems with fibrosis, the hardening of arteries and veins, and vasoconstriction, the regulation of how the blood vessels are working, this dengue fever-like attribute suggests that what could be happening is that the very cell walls are being destructured as the antibodies interact with them, and that you are having epithelial or tissue failure such that you could have internal bleeding, and that's called a hemorrhagic fever. I mean, hemorrhaging is internal bleeding. That's all it is. So that the bodies are literally potentially having this outcome. Do we know for certain this is exactly what's happening? No. But what we see is a pattern in the COVID virus, especially in those later infected cases in Wuhan, which may very well have been reinfections, where the symptoms, the manifestation of what's happening, people falling in the streets, that are the sort of things you might see with someone hemorrhaging, where they could seem healthy to the outside potentially, but very quickly as a robust immune response is mounted, and we've seen this with younger people getting sick, that we could be seeing this sort of an event with this ADE coming out, this antibody, put it together here right because I'm reading this, antibody-dependent enhancement being manifest. Do we know that? No, but the evidence is starting to go in this direction. Dr. Martinson does a better job explaining it than I do, but the short version is this disease is bad the first time around. The growing body of evidence suggests for different reasons it may be worse the second time around. And there is an article that he covers in exhaustive depth. It is from the Journal of Virology, and this was published on February 4th, 2020, from the University of Minnesota, working in conjunction with the Beijing Institute of Microbiology and the New York Blood Center, the Lindsay Kimball Research Institute. It talks about the molecular mechanism for antibody-dependent enhancement of coronavirus entry. I'm not going to read it to you. Dr. Martinson does it for you. It's 45 pages, but basically it explains biochemically the means by which you see COVID acting in a way that is analogous to what dengue fever does. And I want to draw back to one other point here that I think is really worthwhile. And this was something that got withdrawn, but it was a study that was published at the beginning of this outbreak. This was, I believe, on January 30th, if I'm not mistaken. The uncanny similarity of unique inserts in the 2019 NCOV spike protein to HIV-1. And it was and I'll share this because this is an archive because it got withdrawn, but it was talking about the means through the DNA sampling, or excuse me, the RNA sampling rather, I should say, and that the way the protein was shaped, that this looks and acts a lot like HIV in terms of its entry points as well. So here is the terrible outcome, which I am forced to share with you. We have in COVID-19 a virus that we are being told is no worse than the flu, but that has certain traits. It has a protein structure that looks like HIV. It has the ability to impact antibodies in the way that dengue fever does. It has transmissibility rates that are similar to and can be easily mistaken for the flu, and that its ultimate load of transmission has been rated by the International Committee for the Taxonomy of Virus as being structurally similar to SARS. We are talking about 4 of the most deadly diseases known to mankind, all having features that are covered in this COVID-19 virus. Do we know that why this happened? Could it be an organic development? There are virologists who say yes. And as we find that they make the argument that the transmission goes from the bat coronavirus through an intermediary, maybe the Malaysian pangolin, kind of like a weird, scaly, aardvark-looking mammal. Maybe. I don't know. But I think we have to ask. This came out of Wuhan. The biolab was right there. China's suppressing patient 0. And we have 4 different elements now of terrible diseases in this coronavirus. Our governments are covering it up. The social media is not sharing any information. Is this much worse than we understand? Not just in a first outbreak, but a second one. And that, honestly, is the thing that has me losing sleep at night, which is I'm asking myself, if you get a second infection of this, we get through this once. Everyone goes through terrible loss of life, hopefully under 2% like they're reporting. Maybe there are breakdowns in the system. We see these outbreaks happening at once. The numbers might get to 20%. I don't even know. And we could have social breakdown systems where we don't have civil order stay still. I've had one estimate said to me from a very competent researcher tell me that the cost to this economy alone, if this gets covered, is somewhere between $500 billion and $3 trillion. Just to put that in context, that's a sixth of the value of the American economy in the course of a year, or potentially higher. And that's not talking about collateral damage to economic disruption. That's just saying the loss of working hours from people being sick if this infection follows a least case, best case scenario with existing supply chain disruptions. And that's assuming that the things stay together, which is a pretty big assumption. And I don't want to scare you. I just want you to be taking seriously how important this is. I know these are big numbers. I know it's frightening. And that's why I'm here to try to help put this in context. This is what I do. I talk about trends. For a living, pretty much talk about really scary things and explain how people are supposed to live through them. Remember, we lived through the Black Plague. We lived through these terrible things. But with this, people really need to be aware that this is something different. It's something bad. And if we don't approach this intelligently, if we don't keep order enough in terms of how we behave, and we let the first wave take us down, when we are scrambling and that second wave hits, the consequences to humanity could be devastating. And I'm not exaggerating when I'm saying that we don't know this, but the potential exists for a death toll before this is all done to go beyond 6 figures, 7, 8, even 9 or 10 figures. I hope not. That's a worst case scenario, but we need to go ahead and answer these questions, seek the evidence, and hopefully refute these sorts of claims. However, when our governments just go out there and they tell us, don't worry, it's okay, we've got this, and they attack the people asking questions, we can't get the answers that we all need to be working on together. I mean, I'm devoting 12 hours a day to this because I can see the writing on the wall, and I'm hoping I'm just reading the language wrong. And a little bit of a difference could make a big difference in outcomes. What can you do? Quarantine being imposed is not going to help. N95 masks, which have been promoted by many people, including me, with aerosolization, only provide limited support. You need to be looking for N100s, but the best thing you can do that I am recommending, self-quarantine where and when you can. Make efforts to get access to UVC filters. They kill smaller viruses. Get one for your home, especially if you're in an urban setting. If you're in an apartment or a place with shared air, or people in your house who aren't taking this as seriously as you are. I've had a lot of people say, how can I convince my wife, my husband, my mother, my father, my son, my daughter? I don't know the answer to that, other than that they're going to probably have to wait till the evidence comes out. I think the evidence will come out next week, or even this weekend, that this is something that can no longer be ignored. And when that happens, there's going to be all those collateral issues we've been talking about these first 2 weeks, the supply chain disruptions. Do not wait until this weekend to begin preparing. You see worldwide these suggestions of 14-day, 24-day, 30-day self-quarantines. You should be prepared to survive that, because what will happen if this happens and people do not follow that is people who violate that will be blocked, at first by the government, or as we see in China, by the people themselves, because they do not want this to spread. I do not want you to be dealing with that. Hopefully, these prognostications prove more frightful than need be, but be prepared. Please be prepared. Get the supplies now. If you have questions, go get the book Surviving Coronavirus at a price. It costs $3, I think, $3 or $4. As an ebook, has good advice in there. Or just write me an email if you can't afford it. If you really can't, coronaviruscentral@pm.me. I'll send you it. Get your 90-day food supply, personal protection equipment. Make sure you have access to good water, and begin preparing your environment at work, at home, and be ready for this. That's the best we can do. I think it's actually already out there, and we're going to have to all deal with it. This broadcast will continue. I'm up here in rural Maine. We make a joke in our group, our Telegram group. We call it the bunker, but literally where I'm at this point is pretty close to one. And I'm sharing all this with you because I want you to be safe. And as we come here to the end of another broadcast, hopefully we'll have some better news tomorrow. I think I need it. I'm sure you do also. We're going to look at some treatments that are out there and let you know that while things hold together, there are things we can do, but we need to really protect our medical professionals. I think that's a good point of emphasis. And I'll just lead in prayer as I do at the end of this. I hope the Lord protects us and uses this opportunity to lead us to act more wisely toward one another, and that we begin preparing to protect our loved ones. We ask for comfort for the suffering, for peace for everyone, and to understand that humankind needs to come together to begin dealing with this crisis. And we ask that our officials who are tasked with dealing with this show wisdom in reaching out to the people and helping work with us to solve this, instead of either A, saving themselves, or B, thinking they can do this alone. We're all in this together, ladies and gentlemen, and Coronavirus Central will continue leading the effort to spread information. God bless you all, and have a very good day. Please be safe out there.